the role of the leadership in Zimbabwe with regards to HIV. We've reached a stage whereby there is denial at the highest level. I've been living with HIV for the last 11 years, and this is my 11th year. In 2004, 166,000 people died of AIDS-related deaths. But it is also a known fact from reliable sources that we are having 50 people dying only in Harare per day. Basic raw materials that are needed to just make painkillers, they are not there. That's how is the economic situation. This also being culminated by, I think, international isolation, which has not impacted on politicians, but has impacted on the poor person living with HIV. Some of the things that we are actually doing to deal with stigma and poverty among people living with HIV and AIDS is we are encouraging self-help projects. In Zimbabwe, we have got a number of people who are policymakers who are down as a result of most probably HIV-related illnesses, but not any one of them has come out yet to say they are suffering or they are affected by HIV.
Once we found out we are one of the most seriously affected countries, we had to draw it to the attention of the nation that we are in trouble and that we had to do something about it. People were testing, but not as many as we had hoped. And we felt that the constraint was stigma. People pointed at people visiting counseling and testing centers, so that if you went to test yourself at these special clinics, people pointed their finger at you and said, yeah, he must be HIV positive, even when you are not. And therefore, we thought of overcoming that. That's why we decided on routine testing. However, if, in spite of all these good intentions, in spite of all the things that we think are good for you, if you don't want to be tested, yes, we will not.
Early 26 February 2005, I crowned Miss HIV stigma free. Especially at schools, at school level, accept the people living with HIV and AIDS. Today we are going to talk about stigma. Do you understand stigma? We still have a long way to go to fight this stigma associated to HIV and AIDS. They don't want their voices to be heard, especially in Botswana. I wish to tell South Africa we can really make our voices to be heard. I've realized most of us people living with HIV and AIDS are ribereki. So why can't the government just the ministry whatever, whoever can be involved? There should be greater involvement of people living with HIV and AIDS. You go to our hospitals, shortage of nurses. I'm not saying nurses because we are not trained to be nurses. We can play a role because we are living with HIV and AIDS. We bear the witness of living with HIV and AIDS. We are the right people to give the newly diagnosed that support, that care, because we are living with it.
One mogare hela jaaka mathata a mangwe kana malwetse a mangwe ga o ka wa koga wa itse seemo sa gago ya re ga o thoka thuso wa kgona go e bona go santse go na le nako go raya gore o na le tšhono kana chance e botoka ya go tshela lobaka le lo leele.
Ka me ke bidiwa David Siyayinqoba ke bereka mo Botswana network of people living with HIV and AIDS. Mathata a re lebaganang le one re le batho ba re tshelang ka mogare wa HIV ka Botswana ka bophara. Santa ke stigma and discrimination e sampele a problem mo gompieno. Sa bobedi ke banna meaning men, banna ba few mo go HIV AIDS. Di support group tsa rona di na le agre batho ba ha ba le 25 o tla itela re maybe hona le one man kana banna ba babedi wa bona. So e sampele a problem for why banna ba sa tsene mo HIV AIDS issues.
To go to form
ke dira jalo ke go ba supetsa gore nya kana seo se ke bolwetse hela jaaka bolwetse bongwe ke mathata a re thagetseng ga re itse gore bo re tswala kae mme ga gore ga o na le mogare ga o tshwane le batho ba bangwe jaanong ke sone se ne ke dira jalo e le gore ke mo seemong se ne re le mo go sone rona Batswana.